How have governments on the African continent fared when it comes to this? We're joined from Nairobi, Kenya by Carol Obure, and she's from the University of Nairobi. Thank you very much, Carol, for joining us. Perhaps let's start with what may appear as a very obvious question, but what is the role of crisis communication?
Thank you very much, Didu, for inviting me to this program. The role of communications goes beyond just communicating. It includes storytelling, turning complex arguments and ideas into simple and digestible ones. And in a crisis like this, communicators are the unacknowledged frontliners, I would say, in the sense that they effectively unpackage information from the researchers, epidemiologists, and all the doctors and all the medical practitioners into practicable, edible, and digestible information for the consumption of the public. So they need to advance their views that are not, in a way that is acceptable and is easily understandable by the society as well.
When we look at communities, for instance, in Kenya, Kibera, Africa's largest slum, we go to Ghana, you've got Nima, you come to South Africa, you've got Alexandria and many other places where most of the recommendations by the World Health Organization are kind of hard to implement in terms of social distancing and people keeping their distance from each other. What would be your state of assessment in terms of how governments on the continent have communicated about the pandemic?
First of all, I have to compliment the African governments for the efforts that they have made in handling communication around the pandemic. Everyone was caught flat-footed, of course, and those who have performed better have trodden the fine line between the rule of law, human rights, and freedoms. That I understand. Freedoms remain critical in this conversation during this pandemic. And given how governments have compelled to virtually shut down economies to met out and also met out draconian rules and regulations into the population, that is like physical distancing, protocols, banning social gatherings, enforcement of face masks, all these things are, they're not things that people are used to. Now, going back to people in the informal settlements, like the Kibera in Nairobi, it's not possible for them to, for example, keep a physical distance. It can't work because these people, people in the slum dwellers, they don't have most of the social amenities. A small, like a 10-meter square foot, is occupied by quite a number of like a whole family, maybe like a family of 6 or 4 or even 10. So it's not possible for some of these things to be implemented. So I feel that our governments, we need there need to be a paradigm shift. We need to reevaluate. We need to relook into what works for us. Africa. We need to, as Africans, we need to try and find solutions to our local problems. I do understand initially when COVID-19 was, let me just say that it sprang on us. We didn't expect it. We were all shocked, and of course now we had to adopt what everyone else was doing, physical distancing. It was a fear campaign. And of course that was very effective at that point, considering we didn't know the enemy attacking us. But right now that we have data, we are looking at statistics. Is it possible for us to relook into our strategies, communication strategies, and any other ways of managing the pandemic so that people in the slum dwellers can also, have their dignity back? Because right now they are just, they have to depend on handouts from the government, from NGOs, and all other well-wishers. They need themselves back. We need our lives back.
Giving people...
In as much as... Yes.
Please finish your thought.
Yeah. So I was saying, so we need our lives back. And just yesterday, I was listening to Dr. Ryan, the WHO emergencies, and he says that COVID-19 might be endemic. That means it might be there to stay with us. So is there a way that, we can work around it so that we come to terms with it? Can we do that? Can our governments look into that?
Very quickly for us, it's an ecosystem of communications, not just on the part of governments, but on the parts of journalists as well as other communicators. What role do we all play in making sure that we give dignity back to people through the communication that we send?
I would say to give dignity back to the people, first of all, we need to get people to own this. We need to, the government should accept the fact that COVID is there. We might not end it. We might not end it right. So is it possible to now, work on a communication strategy that would allow communities to now own this, so that this campaign moves from government-driven to community-driven. Government-driven to community-driven and to individual-driven, so that organizations can have, policies and SOPs around COVID-19 and just for us to see what would work. We need to go back to the table to discuss this, because what we have right now is there is fear. What we are doing right now is creating fear. For example, give an example of something that happens. I think I was watching some videos the other day, and people wear masks because they do not want to be arrested by the police. They are not wearing masks because it is a preventive measure to COVID-19. So you find someone walks around with a mask hung on their ears, and when they see a policeman approaching them, they wear the masks. As soon as the policeman passes them, they get them to remove the mask again. So that is fear of the law enforcement. Initially, because of the curfew, what I noticed in Nairobi was that even the law enforcement were using fear, like you arrested, for example, for flouting the curfew rules. Instead of being taken to holding centers, you're taken to a quarantine center for 14 days. So, and that is why I think if you were following the news, you must have read somewhere that there are people escaping from the quarantine centers. You take people to quarantine centers, obviously they get infected. And then what happens next? They escape from the quarantine centers. Where do they go back? Back into the community. And, these are people who are just trying to earn a living. Most of them were just walking there from work or looking for work. And most of them were people who come from the slum settling areas. So you want to arrest this person, take him to a quarantine center for 14 days. What is his family going to eat?
Carol, thank you very much. Absolutely. I think we got the message quite loudly and clearly. Unfortunately, time is an enemy. Carol Obure is a communications expert, and she's with the University of Nairobi, joining us there from Kenya.